Head and neck anatomy. Head and neck anatomy includes important structures involved in basic body functions such as breathing, digestion, vision, hearing, and processing sensory and motor information. The head and neck also protect vital organs such as the brain, eyes, ears, and upper digestive tract. Here is a detailed explanation of the anatomy of the head and neck. 1. Head. The human head is the part of the body that contains the brain and other vital organ structures that are important for cognitive, sensory, and motor functions. The head consists of the skull, face, and organs related to the senses. A. Skull. The skull is a hard framework that protects the brain and forms the shape of the face. The skull consists of two main parts. 1. Cranium. The upper part of the skull that protects the brain. Parts of the cranium. The cranium consists of several bones such as frontal, the bone that forms the forehead. Parietal, the two bones on the upper side of the skull. Temporal, the bone on the side of the head that protects the ear. Occipital, the bone located at the back of the skull, protecting the back of the brain. Sphenoid, the wing-shaped bone located at the base of the skull. Ethmoid, the small bone between the eyes, forming most of the middle of the face. 2. Facial bones. Form the structure of the face and help support functions such as vision, smell, and digestion. Maxilla, the upper jawbone that supports the upper teeth and part of the roof of the mouth. Mandible, the lower jawbone that moves to facilitate chewing. Nasal bones, the bones that form the upper part of the nose. Zygomatic bones, the cheekbones that also form part of the eye sockets. Lacrimal bones, small bones around the eyes that help form the tear ducts. B. Organs in the head. 1. Brain, the central organ that controls body functions. Located in the cranial cavity and is divided into several parts, including the cerebrum, cerebellum, and brainstem. 2. Eyes, sensory organs that function for vision. The eyes are located in the orbital cavity, which is protected by the facial bones and soft tissue. 3. Ears, organs that function for hearing and balance. The ear consists of 3 parts. Outer ear includes the auricle and ear canal. Middle ear contains the eardrum and tiny bones that transmit sound to the inner ear. Inner ear contains the cochlea for hearing and the semicircular canals for balance. 4. Nose, a respiratory organ that also functions as an organ of smell. The nose consists of bones and cartilage that form the nasal cavity and upper respiratory tract. 5. Mouth, the first digestive organ that involves chewing and absorbing taste. The mouth consists of the lips, teeth, gums, tongue, palate, and back of the mouth. 2. Neck. The neck connects the head to the body and serves as a connecting path for vital structures such as blood vessels, nerves, and respiratory tract. The neck also allows head mobility. A. Cervical vertebrae. The neck consists of 7 vertebrae, cervical vertebrae, that form the upper part of the spine. These vertebrae provide support for the head and allow head movement up, down, and sideways. Atlas, C1, the first vertebra that supports the head and allows movements such as nodding the head. Axis, C2, the second vertebra that allows head rotation, such as shaking the head. B. Neck muscles. The muscles of the neck help maintain the position of the head and allow for a variety of movements. Some of the major muscles in the neck include sternocleidomastoid, SCM, a large muscle located in the front of the neck that rotates and lowers the head. Trapezius, a large muscle located in the back of the neck and upper back that lifts and stabilizes the head. Scalena, muscles on the sides of the neck that assist in breathing and moving the neck. C. Blood vessels and nerves. 1. Carotid artery, large blood vessel that carries oxygen-rich blood to the brain, face, and neck. 2. Jugular vein, blood vessel that carries deoxygenated blood from the head and neck back to the heart. 3. Cranial nerves, nerves that originate directly from the brain and control sensory and motor functions of the head and neck, including the facial nerve, trigeminal, facial, etc., the optic nerve, and the auditory nerve, vestibulocochlear nerve. D. Respiratory and digestive tract. Pharynx, tube that connects the nose and mouth to the throat and the lower part of the digestive and respiratory tracts. The pharynx consists of 3 parts, the nasopharynx, oropharynx, and laryngopharynx. Larynx, known as the voice box, the larynx is located at the top of the trachea and contains the vocal cords that allow us to speak. Trachea, the tube that connects the larynx to the bronchi and allows air to flow to the lungs. Esophagus, the tube that connects the mouth to the stomach, allowing food to move through the digestive system. 3. Functions and roles of head and neck anatomy. Sight, hearing, and smell. The sense organs in the head allow humans to perceive and interpret the world around them through sight, hearing, and smell. Digestion. The mouth begins the digestive process by chewing food and absorbing flavors. The pharynx and esophagus allow food to move through the digestive system. Breathing. The airways in the neck, including the larynx, trachea, and bronchi, allow air to enter the lungs and carbon dioxide to be expelled. Head movement. The muscles of the neck allow the head to move in various directions for body orientation and response to stimuli. 4. Disorders and diseases affecting the head and neck. Migraine, a severe headache that is often accompanied by symptoms such as nausea, vomiting, and sensitivity to light or sound. Head and neck cancer includes cancers of the mouth, throat, skull, and vocal cords. Sinusitis, inflammation of the sinus cavities that causes symptoms such as nasal congestion and headaches. Hearing loss, a disorder of the ear that can be caused by infection, trauma, or aging. Carotid artery stenosis, narrowing of the carotid arteries that can reduce blood flow to the brain and increase the risk of stroke. Whiplash, a neck injury caused by an accident or sudden movement, which can cause pain and limited movement. That is a detailed explanation of the anatomy of the head and neck, which includes major structures such as the skull, neck muscles, sense organs, and respiratory and digestive tracts. The head and neck have many important functions that support various body activities, as well as protecting vital organs.